leading to optimal hospital care. We are evaluating whether the amount of Medicare spending impacts hospital care. We're looking to see what the factors are that affect hospital care, and then in turn make recommendations about policies to the U.S. government. So far, we've found that locations play a big role in the type of care that you will receive, and that Medicare spending did not seem to have an impact on care, but rather the location did. A little bit of background on our project. This project is interesting because we are exploring and analyzing how hospitals can provide optimal care. We can make recommendations to the U.S. government on how to improve care based on our findings. We'd like to make sure that patients are receiving proper care, and an important part of our goal is to make analysis that can help aid patients in making decisions that will help them receive the best care. We'd also like to aid doctors and nurses in helping patients and providing the right care. Our exploratory data analysis had major factors which played various roles in the hospital care. The two major roles were location of the hospital and hospital type. We found that the other factors didn't have as much of an effect on the quality of healthcare given. Most importantly, we found that Medicare spending had no effect on the type of care given. More Medicare spending did not equal better care.
The data collection is begin join the hospital profiles and the spending data. We merged the two data frames. We found the provider ID in the hospital dataset file has a different name. So we renamed it in order to merge with the spending dataset. After that, we also cleaned the data. The data was original data is around 4,800 records. We ended up with 3,200 records. We perform a linear equation on the hospital dataset, and below is the summarization and regression model. In this model, you can see the state with the highest cost are Florida, Louisiana, Massachusetts, Ohio, Texas, and New Jersey, which our model identify as the effect of on the cost. New Mexico, on the other hand, has the second lowest cost. We looked at we looked at to see how distribution of hospital ownership side different in the full data set, the lower cost data set and the higher cost data set, while analyzing why hospital might have fallen into this group. We looked at the diagram above. We can see that the hospital ownership of lower cost and higher cost hospital differs. Government hospitals are much more common in lower cost hospitals, while the higher cost faculties are much more likely to be a private. With this data set, I wanted to look at the amount of deaths occur in DC couple with Medicare patients are using while setting this the data up. I wanted to look at the rate compare after the surgeries are compared that with the number of deaths after surgery to see if there was a relationship. Putting the data on test, I found not only the relationship between the two variables, but there are a quality of care difference between the zip code. People who lived in 20017 zip code have better chance of surviving their surgery compared to people who lived in 20037 or 20007. Looking at this data set, we see that again the average spending per hospital stay the same, but the quality of care, this due to fact of the zip code of this hospital are different. Looking at the data models of Delaware, we can see that the average spending per patient is the same, but the rates accidentally varies. I discover again that the zip code is the only variable that shifting the quality of care. This leads me to believe that the quality of care and the spending per patient are independent on each other.
On this chart, we see a map of the U.S. with the rates of serious complications in the different states. And here you can once again see an idea of how, even though with the spending levels, the levels of complications and such stayed the same, you can see that in the different locations they vary significantly. So it just reiterates the idea that the quality of care is very highly dependent on the location. And then here we see a graph of the quality of care separated by the hospital type. So here you can kind of see that the spreads are relatively similar for the hospitals in each category. So once again, it's not as much of a contributing factor, and really the main contributing factor is location.
After conducting the Tableau analysis, we wanted to compare the data in Weka. We compared the type of hospital, location, and Medicare spending because these were the major factors we got out of our data. We used 5 different model predictors: K-nearest neighbor, SVM, logistical regression, naive Bayes, and J48. With KNN, we got an accuracy result of 96%. We got 94% with SVM, we got 93% with logistical regression. Naive Bayes gave us a 91% accuracy rate, and then lastly with J48, we got an accuracy rate of 99%. As you can see, J48 was our most accurate model predictor and confirmed our theories and suspicions that the location had more of a factor in hospital care rather than Medicare spending. Most importantly, we found that the spending per patient stayed constant while the rate of complications or deaths after surgery varied between zip codes. So in theory, Medicare spending did not really have an impact. In conclusion, this leads us to believe that the better quality of care was provided in the better zip code areas. Medicare spending did not have an impact on quality of care as it stayed constant while the location varied. The type of hospital also played a small part in the quality of care as well. Again, more Medicare spending does not mean better care. For our future work, we'd like to make recommendations to hospitals based on our analysis. We'd also like to conduct further analysis to check to see whether Medicare spending truly has an effect on hospital care or if it does not. We'd also like to explore more locations to see the effects of healthcare and analyze trends. And then lastly, we'd also like to explore a little bit more about the different hospital types. We did focus more on the location and Medicare spending, so we would like to go into more detail about the hospital type since it did play a somewhat small factor in our conclusion. And then for our team reflection, as a team, we've grown so much over the spring semester. Although we did have a shaky start in the beginning with planning and setting meetings, we managed to pull together in the end as a team. We learned the necessity on attending weekly meetings in order for us to plan for the future. We were also able to stay on track attending these meetings, which in turn hastened our project progress. The one thing that we could have improved on was the amount of time we spent per week collaborating and working with one another on the project. However, overall, this was a really great learning experience. We had fun with putting the data to test, and we gained a lot from this project. Thank you for watching.